Some of you are asking if it's indeed okay to massage your lower leg if you have cramps, numbness, pins, and needle sensation caused by nerve damage. The answer is yes in majority of cases. In fact, in this video, I will share with you 4 important pressure points in the lower leg which had been proven by clinical studies to effectively lower both the intensity and the frequency of aching, burning sensation, numbness, and even allodynia or hypersensitivity to touch caused by nerve damage. Stay with me until the end. I will teach you a bonus pressure point if you feel burning and numbness in your foot and for you to know if these natural techniques are for you. Hi, this is again Doc Sherry, Doctor of Physical Therapy, teaching you practical health tips and home exercise programs that you can surely benefit from. With the pursuit of helping you manage neuropathy symptoms as naturally as possible, I will be sharing with you these 4 specific pressure points. Pain management for neuropathy can be challenging. You might be given several medications depending on the severity of your symptoms. And these medications can range from over-the-counter pain relievers, opioids, and even anti-depressants, just for one goal in mind, to suit neuropathy symptoms. However, I have also shared with you that long-term use of these medications can actually have side effects in your body. Here are the 4 specific pressure points that have been proven in clinical research and have helped patients taper off from their oral pain reliever use. Feel free to use any type of lotion or oil while doing these techniques. For our first pressure point, I want you to locate a bony bump in the outer part of your leg. That is actually your fibula, which is the smaller bone in your lower leg. Now, I want you to go slightly inwards up until you feel a small hollow or depression in this area. Using your thumb or your index finger, I want you to provide moderate kneading or circular motion in this area. Massaging this area can actually help release endorphins, your body's natural pain relievers, which will help you cope with the pain naturally. This technique have also been helpful in decreasing numbness and even for patients who have swelling in their knee. Now, for our second pressure point, I want you to locate your shin bone or your tibia, which is actually the larger bone in your lower leg. Now, this time, I want you to check your kneecap. And from the bottom of your kneecap, I want you to measure at least 4 finger widths below. Then try to palpate and try to touch. Try to feel a small hollow or depression in that area. That is actually a muscle. And using your index or thumb, I want you to apply firm circular or kneading motion in this area. This area here is called the master point of the lower leg, and these can help relieve numbness naturally. For our third pressure point, it is helpful for people who always experience cramps because it will really target the back muscles in your lower leg, specifically your gastrocnemius muscle. Now, to do this, I want you to locate your ankle bone. Then, using 4 finger widths also, try to measure above. You can feel a small hollow or depression in that area. Try to have circular or kneading motion in that area for 30 seconds. It will help relieve muscle cramps, which is also a very common symptom of lower limb neuropathy. Some of the symptoms that patients feel with lower leg numbness is pain that is aggravated in long distance walking. So stimulating and massaging this area here would really be helpful. Now, for the last pressure point, this is helpful for patients who experience chemotherapy-induced neuropathy or numbness caused a side effect of chemotherapy treatment. To do this, I want you to locate the base of your big toe and then try to move downwards until you feel the hollow or depression in that area. Using your thumb and your index finger, I want you to stimulate and massage that area for 30 seconds. Before we continue about the pressure point that can help you if you feel burning sensation and numbness in your foot, and for you to know if these techniques are for you or not, at this point I would like to ask a tiny favor from you to please click the like button below if you think that this video is helpful or any videos in our channel. Also, if you haven't subscribed yet, please don't forget to click the subscribe and the bell button below so you will be updated with our weekly health videos. Now, burning sensation and numbness in the foot is a common complaint for patients who have neuropathy. And to help you with that, I want you to stimulate and massage at the center on the sole of your foot. Massaging and kneading this area here will ensure better blood circulation, which is very much needed for healing to take place. Now, mind you, nerve healing can be challenging, especially in areas of the body which are distal or farthest from the heart, such as your foot. Stimulating this area would mean better chances of recovery for you. These are natural techniques that have helped patients taper off from the use of oral pain relievers. Do it consistently. You can do it 2 to 3 times a week, any time of the day. But these techniques are not for you if you're currently having redness, swelling, and discoloration in your lower leg, especially if you have been through surgery, because these can be symptoms of deep vein thrombosis, and it can be fatal once a thrombus formation is dislodged in the lungs. You are not to massage that area not unless you are cleared by your doctor. Also, don't do these techniques if you are currently pregnant because some of these pressure points can actually stimulate labor. This is it for this video. I hope that you find this video helpful. If you want to know about the seeds that you can easily incorporate in your diet to help manage symptoms of neuropathy naturally, I have a video here. Check on it. It will greatly help you. If you want to know about the 4 symptoms of sciatica that you should never take for granted, I also have a video here. Check on it. It will greatly guide you. Thank you very much for watching. This is again Doc Sherry. Stay safe, stay happy and healthy. God bless you.